Good morning, everybody. It's Dr. Polak again from Progressive Pediatrics. This is Insights with your MD. We do this every Friday morning at 10 a.m. on Facebook Live. So this is a little platform where we discuss, or I tell you what's happening in our community for the past week and what things we've seen in our practice and how we're handling them. So the biggest question this week has been from parents about school attendance. I've gotten this question from parents of preschoolers as well as kids in high school, and everyone wants to know, is it safe to send my kids to school? So that's what we're going to be discussing today. I would like you to do your best to please try to share this video or this post, if you're watching on Facebook, with other people in your community. It would be great if we're all on the same page regarding what's going on and what's safe, what isn't. So here's the bottom line. The numbers in New Jersey are much better than they were in April and May. In April and May, at the height of the pandemic, it was pretty bad. It was about 50% of the tests that were done were actually positive. That's a huge number. Now we're down to 1.4% of all the tests that are done in New Jersey for COVID-19 are positive. So we are in a much better place now than we were in April and May, and that's why people are considering sending their kids to school. The other number I'd like you to know, and I promise this is the last number I'm going to mention, it's that 95% of the people who were positive for COVID in the entire United States are adults. 95% are adults and 5% are children. So if your biggest concern is whether your child is at risk, it's not a huge risk for your child, but we're talking about our entire community, and that's why we're having this discussion today. So how do you decide as a parent? And the bottom line is there's really no one answer for everyone. So this week I sat and I talked with many parents about what their family unit is like, how many people in their family, in their immediate family, are high risk in terms of getting very sick from COVID, how many people in their immediate social circle, not just in their family, can get very sick from COVID-19, and who their children will expose if they do go to school. And I help them make those decisions. So of course, we can help you make those decisions. Let us help you make the decisions. And the best way to do it is for you to bring your child in for your physical. We'll make sure everything is fine with your child, and we'll have the discussion. So here's really how you decide. What's the local transmission like? 1.4%. Not so bad. We're doing good. But things may change. And we know that this year, there's no way we can predict what's going to happen in a month. Okay, so if you're deciding to have your child in school now, please understand that you may have to make some major changes in your lifestyle if they decide to close down schools, if the numbers come back up, or if your particular school has an outbreak, either in the entire school or in your child's class. So have a backup sitter or a backup person who's not high risk, hopefully not a grandparent if you have to work to watch your children, because you can definitely count on change this school year. There's no doubt about that. Okay, secondly, I'd like you to consider the three major issues we've spoken about before to decrease transmission. Is decreasing crowding. So you should ask the school, hey, how many people per class? Is it going to be 10 kids per class or 20 kids per class or 30 kids per class? Please make your decision carefully. Are the desks going to be at least 3 to 6 feet apart? That's really important. Will everyone, including the children, be made to wear masks? Absolutely super important. So decreasing crowding is really important to decrease transmission rate. Secondly, ventilation. What's the ventilation like in your child's school and in the classroom where they're going to spend their day? So can we open windows? If we can open windows, then increasing ventilation or have some other form of ventilation is going to decrease our transmission rate greatly. And thirdly is filtration. What are they doing to filter the air where your child is going to be? That also decreases transmission rate. So you want to ask about crowding, ventilation, and filtration in order to make a good decision for your child. So make sure that they do have a really strict everyone wearing mask rule, including all teachers and all other staff members that are going to be in the school. Also, you need to tell your school what your child's needs are. If your child learns differently from others or has special needs, whether you keep them home or send them to school, you need to let the school know. Email them. They're overwhelmed now making decisions. So knowing what your child needs will help them to set things up for your child, whether they need physical therapy, occupational therapy at school, any special things, that would be great, okay? So do that. Last spring, how did your children do in school? Did they like it? Did they learn well? Were they structured? Did they thrive? If they thrived, then your decision is relatively easy whether you can keep them home or not. You probably can keep them home and have them learn from home. If they did not thrive, if you had a lot of connectivity issues with your internet, if your children, I'm sorry, did not learn well, simply enough, you have to send them at some point, or they're just not gonna learn. So these decisions are all so personal and so private. We'll do our best to help you make these really hard decisions. So the last couple of things I want to talk about is because a lot of my patients are also teachers. And I did have this discussion with a few teachers this week. And I want everyone in our community to know that the biggest transmitters in our community are adults, not children, okay? So I would strongly recommend you avoid the teacher's lounge where you're gonna chat with other children. Wear your masks and stay at least 6 feet apart from other teachers. And if you're gonna be speaking with a parent, do your best to do it over the phone rather than face-to-face. Schedule times to have phone conversations or video conversations with parents and children instead of seeing them face-to-face as a teacher to decrease your infection, your possibility of getting infected. That's important. Let's talk about school buses. Honestly, it's going to be super hard to make school buses safer. Okay, so if you can avoid putting your kid on a school bus, try to avoid it. If you have no choice but to put your kid on a school bus, ask them to please leave the windows open if it's safe, right? If they're really high windows, kids can get to, number one. Number two, make sure that they wipe everything down after each trip. And thirdly, make sure that they screen these kids and make them wear masks before they get on the bus. School buses, honestly, are a bit risky during the COVID pandemic. I'm hoping that schools do their best to use the outdoor space that they have, whatever outdoor space they have, both for classes as well as for eating. Lunchtime is going to be very different if we open the schools this year. Even with few children, we don't want them to be in a cafeteria, period. Really important. So I'm hoping you advocate for the fact that your kids can eat outdoors, weather permitting, and not weather permitting, that they have to eat in their classroom with their cohort of classes, with their cohort of students, so that they don't interact with everyone else in the school and possibly spread a virus. So keeping them to their own group. Lockers are totally not a good idea now. They're high touch areas. So if you're going to send your kid to school, please make sure that they have everything they need in one backpack that they have to have with them the entire day. No locker use because it's a high touch area and kids can get sick that way. We're going to need to try to avoid crowding in hallways and using hallways at all, to be honest. So as little hallway use as possible. Don't forget, if you're just walking past someone, you're not going to immediately get it from them if they breathe near you. If you stop and talk to them and have a conversation, especially without the mask, then you're at high risk. So teachers and students, wear masks, don't talk to people in the hallways, get right to your class if you have to move classes, and do your best to stay quiet and safe. You transmit the virus not only by coughing and sneezing, but by speaking, yelling, singing, all of the above. So we need to let them know to be extra careful. And of course, the schools are going to keep everything super clean, including door handles, light switches, chalkboards, desks, everything like that. So these are my recommendations. And again, we're there at Progressive Pediatrics. We're there to help you make some really tough decisions during this year. We're here to make sure that your children are up to date with their vaccines, that they are growing normally and developing well, and to have some other hard discussions that I've had this week with a lot of patients regarding sleep habits, mental health issues, what to do in certain situations. So call us if you need us. These are my viewpoints about the school issue, school attendance issue. And I just want you to know that I'm going to do this every week because honestly, things are changing every week. So what I said this week, I'm hoping is not going to change that much, but it's still possible that it will change if the numbers start to change up or down. So I hope you have a great weekend, and I hope to see you at Progressive Pediatrics. Bye-bye.